Let me talk for a moment about daycare. As the days have gone on, the number of children in daycare has gone down dramatically. If you look at the state-subsidized daycare, at the beginning of the coronavirus, there was 117,000 children in daycare subsidized by the state of Ohio. That number has gone down to about 17,000. So it's gone from 117 down to 17,000. We do not have good numbers in regard to private daycare, where the state is not involved. The best estimate is that there was about 183,000, and there could be around 40,000 in daycare today. The obvious concern in regard to daycare is when you're putting a large number of children together, the social distancing does not work too well, and children are known to share about everything. So we have known that this is a potential challenge. As I said, we've seen these numbers just with no real action by the government go down appreciably. It is time now to move to that next stage with daycare. And our goals are to keep the kids safe, keep the families of the children safe, and also to make sure that there are enough essential workers, starting with the healthcare industry, to be able to man our hospitals and to do the jobs that need to be done. So we will have a change in daycare, and this change will start on Thursday. All centers beginning on Thursday must operate under a temporary pandemic child care license. And I know some centers have already applied for that, and that is in the works with some of them. We are going down to a maximum of 6 children per room. 6 children per room. This is a rather dramatic change, but I felt that was necessary to minimize the risk to these children from other children in regard to coronavirus, but also the risk that poses to that child's family when that child goes home. By putting them into groups of 6, we are minimizing that risk and, in a sense, compartmentalizing these kids. And let me read a part of what the order will say. Small group sizes, no more than 6 children in a class. Ratio in group sizes, let's see. Reduce ratios to 1 teacher to no more than 6 children. Limit use of shared space or mixing of groups. If shared space is used, must have a rigorous cleaning schedule, and we would recommend actually not having common space, so that you would have the 6 children who would be in one unit. The goal is to keep children of parents of the same employer together whenever possible. Again, to try to keep down the risk. Limit parent interaction at the drop-off and pickup. This program will operate until April 30th, and certainly may be extended beyond that period of time. Let me now turn to Dr. Acton for comments, and then Lieutenant Governor John Houston.